Well, tell us about Spot Rehab.
Well, Spot Rehab is a locally owned and operated rehab agency as well as a home health care agency. We've been in existence for 30 years and owned by therapists. And Kirsten is our area specialist in dementia and memory loss care.
All right. Well, Kristen, how does it work? Do you come to my house then and take care of things, or what do you do?
We have multiple options. We can see people in our clinic, and we can also see people in their homes for any assessments that they need.
It all depends upon personal mobility.
Actually, we can see people that are not homebound through the clinic in their homes, which is a really nice way to do it instead of having to meet the criteria for homebound status.
Well, let me ask, how is business? Are you guys, do you have openings to take care of folks?
Business is very busy right now, but we do make room and we meet the needs, especially when people are either in crises or really need some help. The main thing is anybody who's diagnosed with a mild cognitive impairment really should have an order for occupational therapy. And Spot Rehab is really heavy in having many occupational therapists. Occupational therapists walk along the journey with somebody who's been diagnosed with memory loss and look at all of their daily activities, getting dressed, bathing, what they like to do.
Now, for us, seeing that as a caregiver, we may not want to see things. We may not want to recognize certain things, correct?
Of course, you don't want to, but the main thing with occupational therapy, it works with the client, but as well the family members, because if you have like little adaptive techniques or modifications or ideas or tips to make everyday activities a little easier for those living with memory loss, that's where Kirsten comes up with a whole list of recommendations in bathing, in everything.
What I was getting to is sometimes we don't want to see things that a professional will see.
Exactly. It is hard. And that's why getting to know those families and being able to meet them where their needs are is so important.
Very, very important, folks. If you can stay at home as long as possible, perhaps Spot Rehab can make all of that happen.
Hey, Bob, could you ask him about driving evaluations?
Oh, how about driving evaluations?
Sure. So with we don't do the behind the wheel driving, but we do make the recommendation if needed. But our cognitive testing that we do complete on a regular basis gives scoring that even indicates if it's safe for you, problem solving wise, memory wise, to continue driving.
One of those first things, get that baseline established.
Exactly. And sooner rather than later. And then with those recommendations or the scores, we don't just say, hey, here's your score. You can or can't do whatever. We give the recommendations and we walk this journey with you and make the referral to the Good Shepherds and Arises and DCAN to allow for success.
Good question, Dr. Zook.